filling falls out and it's not painful, we probably wouldn't consider that a dental emergency. We'd get you in the next day or as soon as we possibly can to rectify that. If the filling comes out due to decay and your tooth is very sensitive and now throbby, achy, then that borders on probably needing a root canal, so we might cover you with an antibiotic over the phone by calling in a prescription and then getting you back in as soon as your schedule and our schedule aligns. The other call we get sometimes is that, hey doc, my crown popped off. A simple, quick, easy fix to that is just putting a little Vaseline on the inside of the crown and squishing it back on there. I always have to ask, is the crown hollow or is there stuff inside the crown? And if the answer is there's stuff inside the crown, then that stuff inside the crown is your tooth, and it's not as easy fix as just sticking the crown back on. It's likely going to have to be built back up and a new crown made. So if you're not in pain, we can get you in the next day. If you are in pain, we try to get you in that day. But if you're out of town and need a quick fix and the crown is hollow, easy fix is to put a little Vaseline in it and push it back on there. And that usually gets you a day or two until you can get back to our office and be seen, and we can glue it back on permanently.